Right. Okay. You know, if you think about women or men or anyone in the workplace, one of the most valuable concepts that I've finally come to understand is trust. So, number one, don't make assumptions for anyone. Let them make their decisions for their own life. So, lots of times people will have this sort of underlying need to say, well, I'm not going to approach her with that task or that job because maybe she just had a baby and I think she'd be too overwhelmed, or maybe she just got married, or maybe she's single so she wants to travel. Well, all those are assumptions. None of that's fair. What you should do is ask the person, what do they want, and let them and trust them to make up their own mind, to know their own life, and to know their circumstances. Over and over again, that's something I experienced, was people presumed that they knew what I wanted because I was a mother and also in emergency medicine. That wasn't a fair assumption. My gender roles in my family are a little atypical or non-traditional, and we're both happy that way. So don't presume, don't assume, and trust people to know themselves. The flip side to that is you have to trust yourself, and you have to know yourself. And I have to be able to trust you to speak up and tell me what you need, what you want, and what's right for you. So the trust has to go in all directions. You have to trust yourself. You have to trust that the person you're communicating with knows what they want, knows who they are, and trust that they'll tell you the right answer. I think that's the scariest part, but that's really how we can advocate for ourselves, for the people around us, and all people around us. Just ask.
Why do you think it's so challenging to advocate for yourself in situations like that?
You know, fundamentally, I think we just all want to be liked and respected. And so we get so scared about what failure will mean, and what will we be embarrassed. And it's so interesting that we spend so much time being afraid of being embarrassed, because I'm embarrassed all the time, and it really never hurts me, right? We actually all grow through it. And intellectually we can know that, but we really hate the way that it feels. So I think we're scared to ask because we're scared of the answers. We're scared either we can't handle no, or that if we try and fail, it'll be embarrassing. And sometimes we're scared that the answer is yes. And then we'll have to actually step up and really put energy into something that maybe we aren't sure we're ready for. I started in emergency medicine, and it wasn't until I worked in the academic department that I still work in with colleagues who I love, who all happen to be male. For most of the time I've worked there, I was the only female faculty member. But it's so funny because when I arrived there, I had no idea that I was a female physician. I just thought I was a doctor. It was when I arrived there and the stark lack of other women suddenly became apparent that I was a female physician. And sometimes it mattered. Occasionally patients who have religious beliefs or social expectations and cultural issues where they have a strong preference about a gender provider, it can become relevant. And so it was hard. It's also really hard in those kinds of environments because you end up like you feel like you're the spokesperson for an entire group. I can't say that I've experienced it to the same degree or anything, but I've heard people voice that opinion when they may be of a racial or cultural minority, where they say, it's all this pressure because I can't be the spokesperson for this entire group. And so for much of my career in medicine, I felt like I was that for women, which was awkward.
You don't have to answer this if you don't want to. How would you cope with being treated that way, whether you were asked to not be in a room or be in a room based off of your gender and not based off of your qualifications?
Sometimes it would make me mad. Oftentimes it would frustrate me. Um, but ultimately, I think I did what most physicians and people who work in ERs everywhere do. They do whatever's right for the patient. And so if it makes this really bad day this person is having, because they ended up in an emergency room, if it makes things a little easier for them, then that's what we need to do. But sometimes I'd gripe about it later. I can't even pretend.
So.
It was interesting because some of my closest friends continue to be those male physicians, and I found them to be incredibly supportive. Our children went the same age. It's because of my male physicians that I was able to make it to all the school plays. They were supportive of me breastfeeding. They were just incredibly supportive in every aspect. And I don't know if being physicians helped or they just happened to be really good humans. But I couldn't have asked for better colleagues all these years. I'm Jessica Whittle. I'm a wife, I'm a mother, I'm a chief medical officer, I'm vice president of clinical research, I'm an emergency medicine physician, I'm a professor, oh, and I'm a woman.